Today we shall learn about a very interesting concept that is all about the blood pressure. So what do you think is blood pressure? The pressure exerted by blood. But where it will be exerted, where it will be shown? It is shown in the arteries. So the pressure which is exerted by blood on the walls of the arteries, is what is called as blood pressure, because arteries are the main blood vessels which will be taking the blood from the heart to all the parts of the body. So blood pressure will be measured in the arteries. So coming to what is the normal blood pressure we have. So we have a normal blood pressure of 120 by 80 millimeters of mercury. So it is measured in terms of millimeters of mercury. So the normal BP value is 120 by 80. So what does 120 and 80 represent? The 120 represents what is called systole. So if you remember what is systole, systole is nothing but it is the contraction of the heart. Okay, so the pressure when the heart is contracting is what is called systole. So the upper number or the numerator indicates the systole value, and the denominator indicates the diastole value. That is, when the heart is in relaxed state, the pressure that will be exerted will be measured, and that will be your diastolic value. So your BP will be given as systole by diastole, and the normal level what we have is 120 by 80 millimeters of Hg, that is mercury. Okay, so having normal BP is not a problem. When the BP fluctuates, when it changes, when it becomes a case of a high BP or low BP, it becomes a medical problem. Okay, so let us see what is high BP and what is low BP. Okay, high BP is also called as hypertension. It is also called as hypertension. High BP is also called as hypertension, and the value, if you see, it will be more both in the numerator and denominator compared to the normal BP value. So in the case of high BP, the value of systole and diastole will be around 140 and 90 millimeters of mercury. So when the values scale up to such a level, that will be called the hypertension condition, or it is called the high BP. What will happen if people will have high BP? How this high BP develops? Okay, let us try to understand. So what are the causes for high BP is why the blood pressure has to increase within the arteries. Why the pressure has to increase is the arteries, they will be tubes like this. Okay, so when the walls of the arteries get thickened, then the flow of the blood, it will encounter lot of pressure. So that's why the pressure increases, and therefore the blood pressure values also increase. So what are the causes? Thickening of the arteries. Why the arteries has to thicken? Why the walls of the arteries will get thickened? It is due to bad habits like smoking, alcohol, or eating of lot of junk foods or the fried foods which contain lot of fat in that. So these fatty materials which are there may get deposited within the arteries, and that may lead to increase of the blood pressure. So hypertension is caused by these different causes. So let us try to understand what would be the symptoms. So when the pressure inside the arteries increases, when there is a hypertension condition, then there can be headache, there can be dizziness, there can be occasional nose bleeding problem. Okay, there can be shortness of breath. Okay, and in severe cases, it can also lead to strokes and cardiac arrest. What is stroke? Stroke is nothing but paralysis. So how that can happen? So because of high blood pressure, what can happen is the arteries can rupture and clots can develop within the arteries, which will block the blood flow, and that can lead to paralysis or stroke condition. And cardiac arrest problem can also come, wherein the pumping of the heart may be stopped. Okay, or kidney problems can come. So severe would be the hypertension problem. Okay, so in order to reduce that, people need regular medicines. They have to take regular medicines in time, because there is no cure to high BP. Then how to control? Can we control it? Yes, obviously any disease can be controlled in most of the cases. Okay, so here also the hypertension can be controlled by reducing the salt intake in the food. Okay, avoiding the oily and spicy foods, taking balanced diet, doing regular exercises, which is always a good habit to reduce any kind of lifestyle diseases, and regular monitoring of your BP levels is also very, very important. So by adopting these methods, you can control the levels of high BP, whatever that have been developed. Because there is no cure, obviously you have to follow the control methods. Then coming to the other case, that is the case of the low BP. So our BP can also fall down below the normal level. So normal level was 120/80. When the levels decrease both in the numerator and denominator, when the number is low compared to the normal level, it will be called low BP. As you can see, it is 90/60 millimeters of mercury. It is also called as hypotension. High BP is hypertension, low BP is hypotension. So in the case of hypotension, what are the causes for hypotension? If you have to see, it can be dehydration, which will lead to lower amount of blood volume. When water content in the blood decreases, what will happen? The volume of the blood decreases, because of which the pressure also decreases. So dehydration, any heart problems, any problems in the valves because of which the pumping is not effective, that can also lead to low BP. Low salt intake and maybe interactions with other medicines, whatever you are taking. These may be the reasons for the low BP situation. So what will be the symptoms in the case of low BP? It is feeling weak, because many of the parts, they are not receiving enough blood. Because the BP is low, the blood is not getting pumped with enough pressure to different organs. So you will feel weak. There can be dizziness, vision can be blurred, you cannot see the things more properly. There can be some amount of confusion and nausea, sensation of vomiting can also develop when there is a case of low BP. So what we have to do, there are as such no medicines, for low BP. Usually they will manage with the dietary changes. What can be done? So we can stay hydrated. We can have food with the intake of some extra salt in it. Usually some buttermilk or something can be taken with extra salt in it. And then we can wear compression stockings. Compression stockings are usually for varicose veins and all, they wear socks, which are called the compression stockings. So that actually will help in enhancing the blood pressure. And checking the medical interactions. So you can just check out with what medicines you are getting this low BP problem, and you can try to adjust those dosages. So these are all the changes what we can bring about to control our low BP problem. Then BP will be usually measured with an apparatus called sphygmomanometer, or it is called the BP apparatus. So many times all of us might have visited doctors and they might have used this type of equipment in order to check our BP. What they will do, there will be a cuff inside this. So this is the cuff. So what they will do, they will tie a cuff to your left hand. So there is an artery here which is called the brachial artery. The artery is called brachial artery. This particular artery is very close to heart, and accurate measurement of the blood pressure can be done through this. So that's why usually the cuff will be tied to the brachial artery onto your left side. Left side is close to the heart. So that's why usually the cuff is tied here, not to the legs or not to the thigh, not to the hand or any other where. Because though we have arteries in all other places, this is the correct artery, which will be close to the heart, and where correct pressure can also be detected. Therefore, usually doctors will tie the cuff to your left hand, and they will take the measurement using this. So when the cuff is tied, first what they will do, they will close the knob of a small balloon like thing, the tube, and they will start pressing it. So what will happen? The cuff will become swollen with the pressure. Lot of pressure will be created. How they will be detecting the blood pressure is, the doctor will keep a stethoscope and he will keep the dial of the stethoscope and will keep on the elbow point there. So when the pressure is slowly reduced through that button, what will happen at a point, initially the doctor starts hearing the sound for the first time, and that will be taken as your systolic value. And slowly when he goes on releasing the knob like that, the pressure all goes on decreasing, and at one particular point no sound can be heard, and that will be taken as the diastolic point. So like the systole and diastole, okay, values will be detected, and that will be given as your blood pressure value. Okay, so nowadays digital apparatus are also available, okay, which can also be used to detect your BP without any assistance. In the home only you can just put it on, and then that will give all, okay, your BP directly, because of the microprocessor chips which are there in that. They will help in detection of your BP easily. Then, so here I have written something very interesting, TPA, which will stand for tissue plasminogen activator. Tissue plasminogen activator. So market name is Altiplase. It is called Altiplase. The medicine is Altiplase. So this is a medicine in case of people suddenly, if they develop the stroke or paralytic condition suddenly, within 4 to 4.5 hours of window period, if they are given this particular injection, okay, the TPA injection, if they are given, the clot that is causing the stroke can be resolved and the paralysis can be reverted. So be alert in case of persons, if they develop any stroke like symptoms or paralytic symptoms, if you take them to doctor within this window period and get them administered intravenously with this TPA, then the problem can be easily solved and they can be out of danger of getting the stroke, okay, which is a lifetime impairment. So like this, we have all details about the blood pressure, and we need to take care of this particular condition, okay. So let us not make it fluctuating like this, and let us see that it is under control always.